and a leading expert in the field of diabetes management. And so we are going to be discussing the latest research on diabetes, exploring the different types of diabetes, sharing strategies for living with this condition. So if you or a loved one is living with diabetes, you can join the conversation via our WhatsApp is 055-5561-034 or across our social media handles, and then we can have these conversations and you can send your comments and anything that you want to know about diabetes through. Good morning, Doc. How are you?
Good morning.
It's like there's some sort of telepathy. There's purple everywhere. How are you?
I'm fine.
How was your weekend? The long weekend. What did you do? What did you do? Were you at the clinic?
Yes, I was working. Yeah.
Was it really busy? Do you have lots of cases?
Yes.
Really?
We had a lot of cases.
So is it true that when it's festivities or holidays, there are cases that rise at the hospital? True or false?
It actually depends on the department you're working in.
Okay. So which department is usually over the holidays?
You could say surgery.
Okay.
Yeah.
Oh, okay. Well, welcome to the show. This morning, though, we are not talking surgery, we are talking diabetes.
Yes, please.
Okay, so first, when you say diabetes to a layperson, if you're going to explain it to somebody who doesn't know but has heard about the condition, what would you say diabetes is?
So, you say diabetes is like a group of diseases which is characterized by high blood sugar levels over a prolonged period of time, and is due to either an insulin deficiency or the cell's inability to respond to insulin.
Right. You mentioned a group of diseases.
Yeah.
Make up diabetes.
Yes.
When you say that, explain what kind of diseases.
So, diabetes is not like a single entity. There are different types of diabetes. So we have type 1, type 2, and we have gestational diabetes that occurs in pregnant women who don't have a prior diagnosis of diabetes.
Okay.
Yeah.
So what, is everybody prone to getting diabetes, or is genetic?
I wouldn't say everyone is prone to getting diabetes, but there's a genetic predisposition. So sometimes it runs in families, and sometimes our lifestyle also influences if we would get it or not. So if you tend to have a sedentary lifestyle, you're always sitting at work, you don't move around, then a poor diet, so you tend to eat a lot of refined sugar, so the Coke, the Fantas,
Right.
then eating a lot of fast food which has a lot of fats in it.
Okay, so when can someone be termed as diabetic, or when can I say I am diabetic?
So to diagnose someone with diabetes, there are a range of tests that you have to go through. So we have the fasting blood sugar.
Okay.
So when that is when the person hasn't eaten, then you take a sample of the blood and check the blood glucose levels.
Okay.
So when you check it and it's greater than or equal to 7, then it's likely the person has diabetes.
Okay.
There's also the random blood sugar that you check, maybe meeting the person for the first time, but the person has eaten and you check it.
Right.
If the level of the blood sugar is greater than or equal to 11.1, then you can say that the person has diabetes. But then the fasting blood sugar and the random blood sugar is usually used for monitoring the diseases. You can't really say that the person has it. But then if you want to actually know, there's this test that you can do, the oral glucose tolerance test.
Okay.
So that one, the person takes a glucose drink, then you monitor you check the blood sugar levels at different intervals. So after 2 hours, if the blood sugar levels are greater than or equal to 11.1, you can say that the person has diabetes.
Okay, so this is when it's gotten to the point that the person has to come to a medical facility. But how, are there like symptoms?
Yes.
Like that an individual can look out for, or particular things that start happening to you that would push your mind towards the side that I need to go and do a check for diabetes?
Yes. So some people can present with symptoms. So there are three classical symptoms that you notice a cat across.
Okay.
So there's frequent urination, increased thirst, where they tend to drink a lot of water. Then increased appetite. So they tend to eat. In type 1 diabetes, you notice that the person loses weight.
Okay.
So the person eats enough, but then the person is unable to gain weight or maintain their normal weight. So they tend to lose weight. Then they
That's for the type 1.
yeah.
Okay.
Then they can also present with nausea and vomiting, blurred vision. So for some people, they can be asymptomatic. Some people can come with symptoms, and some people come the first time they present, they have the complications like the diabetic ketoacidosis, where they can come with nausea, vomiting, abdominal pain. They can come unconscious. They are very tired. They are weak and they can't do a lot of things. So it depends on how the person.
Okay, you mentioned frequent urination as a symptom.
Yes.
I thought it's actually better if you urinate a lot. So when you say frequent urination, what's the correct the number of times you have to urinate?
I wouldn't say this. So it depends. So the person has a regular number of times they pass urine during the day. If we are to drink a lot of water, we would.
You expect now you're telling us to drink lots of water because
Yes.
drinking water is good.
Yes.
And so if someone is drinking lots of water, that is a symptom of diabetes too.
No, so then you compare it to their normal. So they will tell you that maybe in a day I pee about 5 times, but now I pee about 10 times. And they will say they drink a lot of water, and they'll talk about the other symptoms that I've mentioned. So then that brings it together for you to make a diagnosis.
And so you wouldn't even know if it's type 1, type 2.
So type 1 is usually in the children and adolescents and young adults, but type 2 is usually seen in like adults. Even though nowadays you can find an adult who has type 1, you can find a child who has type 2. So they are relating it to our lifestyle, how we eat and all those things.
A child who has type 2 diabetes, what's the youngest age you've seen a child coming with diabetes?
So the youngest I've seen is 11 years.
Okay.
And that's actually the peak age, but then it can start from 4 years. Yes, you can diagnose a child from 4 years of diabetes.
Wowzy. Okay, and for adults, we drink a lot of water. Sometimes you can't even keep count of the number of times you're drinking water, or the number of times you're going to the washroom to pee. Now that you've raised that awareness, how many times should I go and urinate? Like in an hour? What's the medically approved number of times to go to the washroom, say in an hour?
I wouldn't say there's a medically approved number of times,
Okay.
but then as you carry out your day-to-day activities, you get to know how many times you visit the washroom to pee.
Okay.
So then if you notice a change, you will notice that, oh, nowadays I'm peeing a lot. So maybe it will bring your attention that something is going on.
Okay, and so which type of diabetes do we usually find in Ghana? Which type presents itself a lot at the hospitals?
Oh, we have the type 1 and the type 2.
Okay,
Yes.
okay. You mentioned one that has to do with gestation.
Yes.
That's for pregnant women.
Yes.
For pregnant women, their bodies change a lot during the period of pregnancy.
Yes.
How would a pregnant woman know that I have to be on alert for diabetes, or there's a telltale sign, or there's something, a deficiency somewhere? How would they know?
So they will have the classical symptoms I mentioned: the frequent urination, increased thirst, increased appetite. Then also when they go for antenatal,
Right.
yes, so they always check their urine for ketones, for glucose and proteins. So when those are noticed in the urine, they are advised to carry on other tests like the oral glucose tolerance test to find out if they are really diabetic.
Right. The image on the screen now is looking at the type 1 diabetes. Can you speak to it?
So the image is showing us how type 1 diabetes occurs.
Right.
Yeah. So it's showing the blood vessel.
Okay, so
In the
there are
stomach.
tiny, I can see like tiny green bubbles and then, well, balls, and then I see blue ones. What's that? What's that referring to?
So the it's showing us the glucose
Okay.
and also insulin. Yes, so we have the stomach. We have the stomach, which helps us to absorb glucose. Then glucose, so when the stomach absorbs the glucose,
Okay.
the glucose goes into the bloodstream.
Okay.
And the glucose builds up in the bloodstream. So insulin, which is the hormone that we need to absorb the glucose into our cells to make energy, the energy that makes us walk, to carry out our day-to-day activities, in type 1 is deficient.
Okay.
So you don't have insulin at all. So you can't absorb the glucose from the bloodstream into your cells. So you tend to have high glucose levels in the blood. Then the patient presents with the diabetes.
Okay. Okay. So now you've been diagnosed. A patient has been diagnosed. It could be a child. It could be an adult, a teen. Treatment. How do we go about treatment? Is it a condition that you have to, is a lifelong condition that you have to live with and manage, or it can be cured?
So diabetes cannot be cured. It's a lifelong condition. It's a chronic condition.
Okay.
So when it comes to management, we have the non-pharmacological, where we educate the patient, tell the patient that it's a lifelong condition. It's a multidisciplinary approach. So it's not just one person that manages you. You have nurses, dietitians, and specialists like the ophthalmologists who check the eyes, and renal physicians who also check the kidneys.
Okay.
So we educate the patient. They have to make lifestyle modifications. So they have to change their diet. So they see a dietitian who draws up a diet plan for them to follow. Before we come to the pharmacological, where we have medications we can give.
Okay.
So for type 1 diabetes, it's mainly insulin because they don't have the insulin. So we give insulin. And insulin comes in different formulations. So before the insulin is given, it depends on the weight of the patient and other factors. So your primary care physician will educate you about it and determine which one to put you on.
Okay.
Then for type 2 diabetes, we have medications. Like the commonest one we use here is metformin.
Okay.
Yes. So they give medications that reduce your blood sugar levels.
Okay. So for type 1, one of the medication is insulin, right? To give it because they don't have insulin at all. So that's what we see people self-injecting.
Yes.
It's quite fascinating. Unfortunately, we don't have any of that to show. But at what times do people who are living with diabetes and have to inject insulin, at what times do they do that? And also, if they don't have it on hand, and if someone is around and the person goes into an emergency, what would you advise people who are around to do?
So for administration, we have specific places where we inject the insulin.
Okay, so
the anterior abdomen, the upper arm, and the anterior part of the thigh.
Okay.
Yes. And also for some people they take the insulin like 2 times a day. But then administering insulin depends on your caloric intake and also your blood glucose level at a time. So normally they check before they eat, then 2 hours after eating, and at bedtime.
Okay. So these medications, especially because you have to take them for the rest of your life, do they come with any side effects?
Yes, they come with side effects, like it can drop your blood glucose levels drastically, and you can have symptoms like sweating and dizziness. So that's what we call the hypoglycemia.
Right.
So in such cases, we always advise patients to have maybe a toffee or Coke or a sugary drink around, so that when it happens, they can take it, so that they don't have any problems.
Okay, so what lifestyle changes would you recommend, Doc, for us to, especially for people who are living with the condition?
Okay, so for those living with diabetes, they have to maintain a very good diet, a balanced diet, but they have to reduce their refined sugars.
Right.
Take a whole lot of grains, fruits and veggies, and that's about it. But the dietitian is it's in the right place to give them a proper diet.
Okay, because then it has to do with things that you're eating.
Yes.
Okay, so in wrapping up, for people who are new to the BFS clinic and who are listening to us, what 5 tips would you want them to go home with when it comes to diabetes?
So what they need to know is that diabetes is a chronic condition.
Right.
It's lifelong, and it has to do with regular monitoring of their blood sugars. They need to exercise a lot, adhere to their medications, and take them at the right time.
Righty.
Then the last thing is, anytime those with diabetes have any sickness, any infections, they should go and see their primary caregiver, because their insulin requirements change during those times.
Okay, someone is asking me to ask you, does the insulin, does it expire? Is it expensive to get?
Right now, I think insulin is on the insurance, so you can get it on NHIS.
It's on NHIS.
Yes.
Okay. And how about people who buy it in bulk and keep it? Is there an expiration date? How do you suggest they keep it, advise they keep it?
So like every drug, it has an expiration date.
Right.
And you don't keep the insulin at room temperature. You need to keep it in the fridge.
Okay.
You need to keep it in a cool environment.
So that's it. Okay, anything you want us to know that we might have forgotten during the interview before we leave?
Okay, another thing that has to do with diabetes is you notice that the person also tends to have recurrent infections.
Okay.
So if there's someone out there who is having recurrent urinary tract infections, fungal infections, and the person has poor wound healing, it's advisable for the person to go to the hospital to have their blood sugars checked.
Okay. Can you also just walk into a pharmacy and maybe buy a kit? Or can you walk into a pharmacy and get checked for diabetes there? Is that possible?
I wouldn't say you can walk there for them to check and tell you have diabetes, but you can walk into a pharmacy and have your blood sugar level checked. If it's high, it's advisable to go to the hospital to have further investigations done before the diagnosis of diabetes.
Okay, so do blood sugar levels vary? Does it vary from person to person, or it has a standard?
So the WHO has come up with a range that is normal. So,
okay, so what's the normal range?
The normal range is between 4 to 6.
4 to 6?
Yes.
So when should you be alarmed?
You should be alarmed when it's greater than or equal to 7.
Nice.
Yes, but it depends on which test you are doing. Okay. So each test has its own value. So for the fasting blood sugar, the normal for you and I, since we don't have diabetes, is 4 to 6.
Okay.
If it's greater than or equal to 7, that is when the person should be worried. If you do the random blood sugar, if it's greater than 11.1, that is when the person should be worried.
Righties. Thank you very much, Doc Irabna Koigreen, for having this conversation with us. Okay, so someone just sent this in quickly, and so we have to do it. It says, when a diabetic person is traveling, what do they need to keep for first aid on the plane? This person is saying on the plane that she was on, a lady fainted, and so for such a situation, what do diabetics need to keep on them for first aid?
So everyone who has diabetes has a glucometer. So when they are traveling, they need to take their glucometer along with them. Then they also need, like I said, if it's hypoglycemia, they need something sweet around so that when they take it, it makes them feel better. Then if the person is on insulin, they should have some of the insulin so that when it happens, they can.
Okay, thank you very much. We've been having a conversation on diabetes with Dr. Irabna Kwegwin. She's a medical doctor at the Kolebu Teaching Hospital. So if you missed part of the conversation or you want to get the whole conversation is on our Facebook page as GTV Ghana. Also coming up, next up is Breakfast Sports with Multi T Saida Sadiq. Also, headlines is with the lawyer historian Yawa Noche Frimpong and Dr. Udro Sain, Director General Internal Audit Service. Also, we have discussions on petrol price falls, effects on the market, and then also on the lifestyle. We are having a conversation with two different groups from the music industry. And so, yeah, we are taking a break. We'll be right